Mohan Nair, who has specialized in child and infant psychiatry and was trained at the University of California in Irvine, as well as Harvard University. Dr. Nair has published on the dangers of psychiatric labeling and on sexual abuse, and he's the founder of the Adult Survivors of Child Abuse, an organization to alert psychiatric patients and addicts to the dangers of medical psychiatric mislabeling and abuse. This he founded in 1986. He founded ASCA, the Codependency Center, a holistic inpatient-outpatient center for incest and abuse survivors, in 1988. And he wrote the book, A Step-by-Step Guide to Recovery for All Adult Survivors in Codependence, which came out in November of 1990, and he is presently an assistant clinical professor at UCLA. Would you please welcome Dr. Mohan Nair. Mohan.
Thank you. Thank you, Dan. It's my pleasure to be here. Yeah, let's have the lights off. I just wanted to. Show the slides here. I'm going to talk about, again, misconceptions about addictions in the mental health field. And by mental health field, I mean both medical and medical, psychiatric, and counseling and psychology. How many of you are mental health professionals here? I guess. How many of you are physicians? Okay. How many of you are psychiatrists? Okay. This is going to be hard on psychiatrists. Okay. Thing is, I worked for many years doing psychiatry, and there was a time in my life when I medicated maybe 100% of my patients. And it has been over the last 7 to 8 years really recognizing that you could not really medicate people for problems, and really understanding that recovery starts from within the person and not from outside. I think the fundamental thing is, you have two fundamental differences. One is like addictions are a moral problem. And when I say addictions, I mean all kind of addictions. I mean addiction to alcohol and drugs, prescription medications, sexual addictions, sexual deviations. And when in my mind, punitive celibacy that is often found within the Catholic Church constitutes one kind of perversion, one kind of addiction. Because when you're obsessed with not allowing your sexuality to, then it is a form of perverse behavior, okay? And this is the way I look at it. I always think that maybe the Christian God should get himself a woman, because among our gods, they copulate and they do all kind of things that then allow us, in a sense, to have permission to do those things. Because even none of us wants our children to grow up without sexuality. It would bother me terribly if I felt that my children would not know what it is to have a sexual awakening and to be able to enjoy the ecstasy of their sexuality. Okay, so I mean sexual addictions, eating disorders, both hyperphagia and hypophagia, anorexia nervosa, addiction to persistent suicidal behavior, addiction to self-mutilation, and of course all the other kind of addictions like gambling and work and those kind of things. So on one hand you have this as a moral problem, and I didn't make a slide for it, but this is a news. This is how they treat addictions in Malaysia, as you know. They hang them, okay? And that's an extreme form of how it's used, where addictions are punished and are seen as evil. And the other thing that I've drawn here is an ice pick. Let me show my first slide. This is one of the medical interventions. This is transorbital lobotomy. This is what's being performed. In fact, an ice pick is inserted. An actual ice pick was actually used in the beginning by Walter Freeman, who you have seen him represented in the film Francis. It's slit under the eyes, and you do a lobotomy. In case you think that this is in the past, in the 1980s, about $500,000 was spent by the federal government towards pursuing lobotomies. And lobotomies are still done, it's just hard. A paper was published in 1986 in Bolivia using lobotomies as a way of treating cocaine addicts. Okay? And just in case you think all this is so far-fetched, Peter Sifnos at Massachusetts General Hospital, who is now well known for his recommendations of short-term psychotherapy, was an ardent advocate of lobotomies for anorexia nervosa. So you have addictions as a moral problem, addictions as a medical problem, and some of the results of that kind of approach are lobotomies. More recently, I attended a conference some time back, and it was about treating sexual addictions and sexual deviant behavior. Of course, the treatment, according to this physician, was Depo-Provera. Okay? We can talk a little bit more about that as we go on. Then it is seeing addictions as a genetic problem. It is explained that Native Americans and some other people have different kinds of genes, and that's the reason why they have this tendency towards addictions. The thing is, everybody has different kinds of genes. Everybody has different kinds of genes, just like everybody's got different thumbprints. We are all unique in our own way. And that uniqueness is reflected in every part of our personality, in our brains, our gut, in the way our heart works, and in the things that we dream and make happen in our lives. And to have different genes means nothing. When I was working in Boston, I worked at the Clinic for Developmental Disorders. And I saw lots and lots of children with the XYY syndrome. And this was back when there was a lot of myth that XYY meant that somehow you're going to be a criminal sociopath, that you were taller than the average. And in fact, it is not true. As we begin to look more carefully at all of these things, you will find that there is tremendous variation in individual genetic makeup. And that just because you have XYY doesn't mean you're going to be a criminal or you're going to be an addict. And these are very unempowering messages to give to people that don't have real basis. If you have read Science, the magazine Science has an article about genetics and alcoholism from last week and 2 weeks back. And, we don't know. I mean, the sense is that there isn't one single gene that accounts for why a person should be alcoholic. And these are very, very complex issues with many factors from before birth and after birth and during birth and what happens in your life that has to do with whether you become an addict or you don't become an addict. So you have genetic problems, where addiction is seen as a genetic problem, or it's seen as a biochemical medical disease. I'm going to go down the list, and then I will touch a little bit on each of these things, and then I will talk about what I feel the real problem is. Okay, so seeing addiction as a biochemical medical disease, seeing it as a brain disease. Then you have the misconception that psychiatrists, especially among psychiatrists, that psychiatrists can fix addictions, that psychotherapists can fix addictions, that addictions can be fixed by shaming, which is especially common among chemical dependency counselors, especially the ones that have not been through inner child work and recovery themselves, that have not gone through second stage recovery. Then there is what I was taught back in my residency, that addicts are just scum that have no motivation, and you really cannot do anything about them. Or the therapy is so prolonged and endless that it's not worth trying, that along with the garbage heap of borderlines and sociopath. They are out to be cast out away from medicine and all help. Then there is a theory that God can fix it. The thing is, I have a great problem with God fixing this. You know, I went from, after I could not get into medical school because I couldn't get into the Air Force because I had glasses, and like all other adolescents and children, I wanted to fly fighter planes. I mean, who doesn't, right? Anyway, I wanted to do the next most glorious thing, which was to become a surgeon, and for several years I did surgery. When you do surgery, one of the things that you're compelled to look at is that you see very young children die deaths of great pain. There is intense physical torture for many months before they die. So I've seen little children die torturous deaths, and I've seen murderers that I've treated die in their sleep at a ripe old age. One cannot look towards God for things that one has to accomplish within oneself. And once again, this, I believe, comes from a concept where God is seen as somebody outside of oneself. The other is that addictions can be easily fixed. So this was like, before I got into this addictions field, I used to have this authoritative voice on TV. The disease is alcoholism. The treatment is the care unit. It's like, you just pop into this place and you're just going to get fixed, you know? Anybody working for the care unit? I mean, okay. The other thing is that addicts are not responsible. That somehow it's like being struck with lightning, you know? It's not your fault. And you're not responsible. So whether you plow your car into 12 people because you're in a drunk, I tell people all the time that addicts are as accountable as child molesters. That for the most part, your arms are not twisted behind your back and somebody pours the alcohol inside you. That there is accountability. That it is a disorder of the will. That you don't wake up one morning and become an addict. That there is a series of actions or inactions that precede one becoming sunk in the demoralization of addictions, whether it's addiction to alcoholism or addictions to deviant behavior. Okay, I'm going to talk a little bit about the individual, the medical problems. Alcoholism as a medical problem. You've got to remember that many of the so-called treatments that have been involved in psychiatry were originally meant for addicts. Insulin coma was originally used to treat addicts. Nijinsky was one of the people that they tried it on first. ECTs were used as for addicts. In fact, the VA hospitals used to use ECT and insulin coma in large numbers for treating addictions. We have newer methods of treating addictions now. See, it's coming from the sky. I mean, there's something very archetypical about this thing, you know. That's coming from heaven, above the clouds, the Savior. But it's a sense, and this is where I think psychiatry and medicine corrupts and disempowers people by the message that something outside of you is going to get you better. And I had a talk with someone that was in the conference. I think you have to exhaust everything else before you think about medication. And what I find, I have not prescribed lithium in the last 3 years. I have not prescribed any major tranquilizers in the last 5 years. I have not prescribed Xanax in over 3 or 4 years. I find that once I give a person a chance, that their desperation for medication begins to change. I was talking to someone to say that, and they were saying that, but you got to use it only when it's extremely necessary, and the anxiety is so much that they just can't bear it. The thing is, anxiety by definition is something that is intolerable, something that accompanies you with an impending sense of doom. You feel you cannot live through the moment. You have this sense of urgency about that is so pervasive, so intense, that you feel you cannot make it into the moment. Okay? This is the kind of urgency that causes people to commit suicide, to cut their wrists, because they cannot make it into the next moment. And yet it is the same feeling that one has to address. And as long as there is an out, by using medications, then the person does not have to confront their feelings and the memories and thoughts that are connected with those feelings. I believe that all kinds of medications are harmful, and especially for people that come from a background of addiction, people that have codependency addictions, and in my opinion, then universally, people that come from a background of abuse. The tendency to look towards the outside for fixes being inherent, that one must not give any kind of medications. In fact, in my treatment program, we have done away with using so-called PRN medications. You should get down. I mean, PRN medications are medications you give as needed, you know. Well, everybody needs them. You know? There's medications for headaches, medications for stomach problems. You have somebody that gets off the phone after they've gotten in an argument with their spouse, and they want some Motrin. Now, Motrin's not addictive, but what happens then is that they don't make the connection between their feelings, the feelings that came out of having to deal with their husband or wife or mother-in-law with a telephone. It isn't as, they skip the step. It's not like they say, I think I'm feeling terrible, I feel lousy, I feel angry, and now this anger is getting converted into a tightness in my neck and my head. It's not. Because of the nature of addictions and how they happen, that whole stage is not there. You get off the phone with your mother-in-law and you go to the nursing station with the headache. That's how it works. See, because addictions come out of a time when emotional pain was not allowed to be felt, not allowed to be thought of, when you had to stand around and listen to beatings or abuse with a hand on your mouth and eat it and take it into your body without thinking about it, without feeling it. And you train yourself to do it. That is how addictions take place. So you don't, it's not steps and reason, and that's the reason why a lot of explaining cognitive type of psychotherapies work so poorly with addictions. You cannot talk yourself out of these things. But we feel that as people go through the suffering of pain, and they are taught to start making images and feelings connected to these physical pains, they're going to be able to tease their way into finding out what caused it. I look at every pain, like every bad dream, every flashback, and compulsive thought as a rope that allows you to come out of the darkness of what is hidden inside, that allows real recovery from addictions. So that's the reason why we don't use any kind of medications, whether they are so-called addictive, as in Xanax and Valium and things like that, which in my opinion are just like alcohol, if not worse, or so-called non-addictive medications like Tagamet and Zantac for stomach problems and Lomotil and all these things which are used to suppress physical problems. Okay? So then you have the genetic. Addiction is a genetic problem. The prime example, when I was in McLean, the big thing that was talked about was addiction in the Native American population. I mean, here is a people, you know, you have, we have, I'm part of all of this now, taken away their land, taken away their air, taken away their culture. When you are, I grew up in the third world, and until I was 7, I lived in a place with no electricity and no plumbing, and every day, and religion and ceremonies and rituals were, I grew up with it. I woke up to it, and I ate with it, and I slept with it. And your life is part of nature. It isn't separate. And you're spiritually connected to it. You tear a person's spirit and you destroy their land and you destroy their culture. And then you have torn their spirit and the child within them and taken away the magic of their life. And then you wonder why they become addicts and why there is so much alcoholism among the... You don't have to look into the genes to see why Native Americans have alcoholism, have a lot of alcoholism. It has to do with the demoralization of a culture because of what has happened. And this is true for cultures, and it is true for individuals. The question, I mean, the real harm when we talk about these alcoholism and addictions as genetic problems is that you start, it's a form of racism. Then you have to ask yourself, I mean, will you really be happy with your daughter marrying an alcoholic? You know, he's got this tainted gene inside him or her, and that they're powerless over. And you wouldn't want to, just like you wouldn't want to breed somebody that's got Huntington's chorea, would you feel comfortable breeding yourself or your children with somebody that has an alcoholic gene? Once again, I think a very disempowering message. I attended this, I gave this talk at Metropolitan State Hospital to the CACs last year, and this was, once again, as it happens a few times a year, it was discovered that alcoholism was genetically caused. And I asked how many, they were all CACs, the Southeast Council for Alcoholism, and they all said that they believed it, because you want to believe it, you know, just like flying saucers. You want to believe that something's going to happen from the outside, that you're going to wake up one day and you will suddenly be resistant to alcohol, depression, child molestation, and mood swings. And the truth is, it never happens. It cannot happen, and you don't want it to happen.